My name is Marina Anderson. I'm doing my demonstration speech for Dr. White's Fundamentals of Speech class, and these are my audience members. I myself am going into the sonography program, and the two of you are also going to be going into a healthcare profession as well. One of you is surgical technology. And so today I'll be showing you how to put on your personal protective equipment when you go into surgery or when you have a patient who has an excessive amount of blood that you don't want to get onto your clothes. The general uniform for any type of healthcare program would be scrubs and some sort of waterproof shoes so you don't get any fluids on yourself. But when you go into surgery or when you have a patient who does have an excessive amount of blood or fluids that are going everywhere, you'll want to put on your protective equipment so you don't get any of those fluids on your clothes, and so they don't get onto your skin or in your mouth or anything like that. So the first thing that you would do is take your hairnet and put it on. Make sure that it covers your hair completely. And then you take your mask and you put the white part on the inside. And you take the metal piece on the inside and put it, kind of fit it around your nose a little bit. And then take the top strings and put them around your ears. Tie it in the back. And then tie the bottom strings around your neck. Okay. And then you would take your gown and slip your gown on and tie that around your back. And then you take your surgical gloves and you peel them open like the directions say, just like that. And then you take the little package out and open it up just like this. And the only place that your fingers can touch are these flaps right here, because these are sterile gloves, so you don't want to touch your fingers to any of the sterile parts of the package. So basically this perimeter is what you can touch. And then when you take your gloves, you want to take your finger, your thumb and your forefinger of your right hand and grab the cuff like this. Stick your left hand in and fit the gloves on. And then you take your gloved hand now and slip it inside the cuff of the right glove and kind of fit it in like that, and then put your hand through and make sure that you don't touch your thumb to your skin or the inside of the glove, because those are not sanitized areas. And if you get your fingers stuck, don't worry about it, just And then when you take your gloves off after you're working on a patient, you obviously, if you have blood all over the gloves, then you're not going to want them to touch your skin, so you would take your thumb and your forefinger of your right hand and take it in the palm and just pull it off like that. And then you would take your finger, your forefinger, underneath the cuff and pull them so they're inside each other, or they're supposed to be inside each other. And then basically the way that you take off your protective wear is the way that you put it on. You take it off backwards. So it's from head to toe, you put it on, and then from toe to head you take it off. So you would take off your gown. And make sure that it's inside out, so if there's any blood or body fluids, it doesn't get all over you. And then throw that away. And then take off your mask. Untie the bottom strings first so the blood, if there's any stuff on the front of your mask, it doesn't slip down and get all over your clothes. And then throw that away. And then take your hairnet off and wash your hands. And you're good to go. That's it. So basically I'll just go back over that again with you. You go from head to toe, put your hairnet on first, your face mask on second, and then you put your gown on, and then you take your surgical gloves and take your thumb and your forefinger, grab the cuff of the left glove and slide your hand in, and then put your left hand inside the cuff of the right glove and slide your hand in, and then you're done, and you just take it off in the opposite way. And that's it.